Hi, my name's Julia Wolfson. I live in Australia and I'm an international partner of CQL, working in different countries, introducing the outcome measures in organisations that are in the process of transforming themselves from a more programmatic and institutionalised way of supporting people to a much more person-directed way of supporting people to get the kind of life that they want. I'd like to share a couple of snapshots, one from Norway, where deinstitutionalisation came about with massive investment from government in the late 1990s, and everybody received an apartment, a television, service providers in some kind of neighbourhood. And actually that has resulted in a great deal of loneliness and isolation because the community connection piece didn't happen. A young person that I interviewed through an amazing conversation in Norway some time ago, when I asked her, what is it that you would like to do? What's important to you? What's your work? She told me that she worked in a sheltered workshop as a weaver. Do you love your work? Yes, it's okay. But I could tell from her reaction that she wasn't very excited. When I asked her, but if you could have anything you wanted, what would it be? She said, oh, I want to work with children. Why do you want to work with children? I want to work with children in a hospital because when I was a small child, I lived for many years in a hospital because of my health issues. And my mother came every single day and not only supported me and was by my side, but she played games and did stuff with all the other kids in the hospital. So I know what it's like to be really lonely in a hospital. Have you told anybody about this? Yes, I said I wanted to work with children. And so the people in this organisation are trying to set up for me a way to help out in a kindergarten. In a kindergarten? Well, they said that would be a good first step if I wanted to work with children. Oh, and what happened? Well, the kindergarten burnt down, so nothing really got organised. What happened after that? Well, they tried to book something in, but then it was holidays and then somebody got sick, so nobody could really support me. What actually eventuated through this conversation was that the workers in that organisation became aware that the reason that this beautiful young woman wanted to work with children was not for the sake of working with children, but she really wanted to bring herself and the impulse of her mother into the hospital with little children that were in great, great need and who had long-term stays in hospital. Her mother had recently died, and from her point of view, this was a way of also carrying on the beautiful spirit of her mother. And they're in the process of setting that up now. Such a simple question. Why do you want to work with children? Good people were intent on helping her get that outcome for her life of children, but actually hadn't quite got underneath what it was that really motivated her, why she wanted that. A second example that I'd like to share with you is from my work in Botswana. Botswana has the highest rate of HIV/AIDS in Africa. And so this is a very huge dilemma in services for everybody in the country, of course. And often when I come back to the organisations that I'm working with, there are people who are no longer present because they've passed on. And this is just part of a way of life. When we came to look at doing the personal outcome measures, so much effort was placed in this organisation in protection from harm, healthcare, people taking their meds, people getting their meds, abuse prevention, how to protect people from violence and sexual violence as part of the whole package that goes with the dilemmas in the country. But the idea that people have their own dreams was not something that really had been pursued in a big way. So during the conversations in the interviews, asking people, what is it that you really want in your life? It was absolutely extraordinary for the workers in the organisation to hear for the first time that people who had been in services for many, many years were saying the most important thing for me is to get a job. Why do you want to get a job? You have beautiful work here in this organisation, in these beautiful workshops, because I want to earn money so that I can go back home to my village and help my mother to put electricity on in her house. This was so profound for the leaders and the practitioners in this particular organisation that they have reinvented over the last years. This, of course, takes time. They have reinvented the whole way that they think about their work, about supporting people, about training, and have begun to see themselves as supporting people to transition back into their own community as people who have something important to bring. That has shifted the emphasis of what they do. The government got wind of this and have become very involved in working with this organisation to look at how their approach can be rolled out across the country. There is a Department of Education in Botswana called the Department of Out-of-School Education. Why is that? Because most people in the country haven't had formal schooling. So how to bring about the beautiful new ideas in the new constitution of the country around inclusion and participation for all in a way that those people really involved in a person's life can dig underneath and find out what is most important. That's another result of the personal outcomes, thinking, an atmosphere and attitude that starts with a small organisation making a big ripple.